Today's episode brought to you by Owens Recovery Science, a single source for PTs who want to add personalized blood flow restriction rehabilitation training to their clinical practice. Get certified at owensrecoveryscience.com. The all-in-one outpatient PT EMR built on automation. That's Empower EMR. They empower owners, physical therapists, billers, and your front desk to profitably provide the best possible patient care experience. Find them online at empoweremr.com. That is empoweremr.com. Good Tuesday morning to you. Breakfast Club PT coming in a few minutes late because I had to refill. I'm sorry. I don't time my refills very properly. He's Tony Maritato. That's Dave Kittle. I'm Jimmy McKay. And we're going to try something. We're going to try something new today. We'll tease that. We're going to do something a little different. We sort of lurk like everybody does. You lurk in the comment section, right? That's what you do. And this one actually came in sort of unsolicited. Like, hey, I hear you guys talking. And they sort of gave us like a Dear Abby, like a Dear Breakfast Clubby. Should we start with that? Do you guys want to go with that?
Let's do it.
All right.
I wonder how many people watching remember Dear Abby to begin with.
Yeah, that is a good question.
I vaguely remember. I'm still on the younger side.
Yeah, that will date you. But essentially, Dear Abby was a column in the newspaper. Kids' newspaper was when people would actually deliver emails in paper form to your house. And people would write in with questions, and then she would sort of give this advice that would, in response. So we'll do this, the Dear Jimmy. Here's the email, the comment that we got, which is, I'm a physical therapist and a facility manager of a large orthopedic and sports medicine clinic of a big ortho group. I had one PT leave about 3 weeks ago, and now I have another put in there 2 weeks. Ugh. The reasons are for job opportunities closer to home and getting out of corporate PT altogether. I also let go a staff member with a managerial role last month. So if you're keeping track, that's 3 down in the last month. From these circumstances, the clinic feels hectic, stressful, and ever-changing. As the facility manager of this clinic, how and what would you communicate to your staff? What things would you want them to be reassured about? What problems do you think you need to solve first and second? I do like that forethought. Like, okay, I can't solve everything at once. And why do you think this happens so frequently in outpatient therapy? Any recommendations to me? Signed, facility manager.
A lot of questions.
Yeah. Where do you want to go first? I love the fact that this person actually put in like the emotions. Like I look at words and I see words like hectic, stressful, and ever changing. That tells me she's paying attention. This, I don't know this person, but this person has empathy, or at least has the chance as empathy, as they are recognizing what their job is. Their job is to recognize that in their staff and then do something about it. So they, at least in my opinion, this person is forward thinking enough to say, I see this. This is my responsibility. I need to act. I don't know what to do. So their response was email a bunch of nitwits on YouTube. No, they probably asked some other people, but they also emailed us. So, so where would you think if you were in this person's role, where do you think you'd start first?
Dave, what do you think?
First thing is rapid action. Depending on your state, in terms of what you can and cannot say to team members and employees about previous team members and employees, that might be a little bit different. So my initial response would be, you need to schedule an in-person meeting with the entire team. And depending on your state laws and regulations as to what I'm able to actually say about the previous therapist or the previous employees who left, depending on that, if you're allowed to, if you're able to, the team meeting is this. Hey guys, so I'm the facility manager. I'm the one that sent this question in. Hey guys, so we know things have been hectic. There's a lot of moving parts. There's a lot going on here. And I want to just kind of communicate everything. This is something I think Jimmy would obviously agree with and appreciate. We have to communicate what's going on. Obviously, things are changing. Folks have been leaving. Now we got to pick up the slack. I just want to communicate real quick. Like the current, the previous 2 therapists, they left because of these reasons. Or maybe you can, if you're not able to say the exact reason, they left because they had to travel, or they told you guys in public. They said it in the clinic, like, hey, I'm traveling, or my wife has to move, or my spouse or my husband has to move because of their job, or we have to relocate or whatever. So therapist A left for this reason, therapist B left for this reason, therapist C left because they, I don't know, like if you're able to say because of performance or whatever, but basically the team is leaving for these reasons. If you're able to say some of those things, you want to communicate like kind of in a professional, nice way. Like, it's not because this place sucks to work at.
Okay.
Now it also might. So you have to have some
right.
awareness, but you want to schedule this in-person meeting, over communicate. You want to get your team members talking like, hey, how do you guys feel? What have you heard in the trenches? Because I just want to communicate this, because otherwise this is like a leaky bucket. And if two therapists just got relocated or fired or whatever, and then one therapist left or fired or whatever, this is like potentially a mutiny on your hands, right? So you need to like patch these holes up. This is rapid action. This is like SOS, send the Coast Guard. We need help right now, because otherwise, like, we have patients coming in and we're not gonna have any therapists. So I would love to hear what Tony would do in this.
Yeah, I mean, this is one of those deals. You said the word over communicate. That's what my wife says all the time. Like, this would be something I would put on my wife's shoulders, not my shoulders, because I'm terrible with this kind of stuff. But it's, you over communicate to bring peace of mind to the crew that's still there. You make the decision. Is this a problem that started 10 years ago building the team culture, or is this something new? Is it just one of those weird things that just happened to coincide with two therapists leaving for better opportunities? I've always been, and I think you see two kinds of leaders. I've been the kind of leader that's like, everything is amazing. This is a great opportunity. Look, this is going to force us to reorganize in a good way. It's going to make things better. This gives us a chance to kind of do a little spring cleaning and improve our systems, optimize, whatever. Other therapy leaders, they're going to be like, okay, I don't care. They're gone. Who cares? Let them go. Business as usual. But to Dave's point, I think this obviously starts to spur those questions in the other employees' minds. And so you talk, you over communicate, you let them know what's the plan, everything's under control, no worries, we're going to be fine.
Yeah.
And you share the strategy of how we're going to move forward from here.
Yeah.
How are we going to recruit more people? How are we going to offload, so we don't burn you guys out? Probably, as my business has consolidated and shrunk, and we've done nothing but shrink for a decade. Every single conversation, every single, let's go out to lunch and connect again with the team, it's always the same message. It's, hey, I know we're getting smaller. I know we're shrinking. I know we're seeing fewer visits, but that's okay. And this is why that's okay, because it gives you guys an opportunity to do more of what you want to do. We're doing this intentionally. This isn't because, the company is dying. Like, it's an intentional move, and we're ready for this. And I think that kind of gives them reassurance and confidence. What do you think, Jimmy?
Yeah, no, I agree with most of what you guys have said. I think the one thing I might change about Dave's is I would say we've had people leave, right? I wouldn't go into the specifics about why those people left. They either talked about it or they didn't. And I'm not even talking about from legality. I want to talk to the people in the room. And that's when I start to agree with both of you, which is to go with Chris Voss and labeling. I would say those things, right? This person says like hectic, stressful, and ever changing. Like, I would address each one of those things in terms of saying, I've heard from a number of you that this is increasing stress. I see that, I recognize it, and there's a plan in place for that. Like, people want, I think Hemingway said, like, the biggest problem in communication is when you think it has occurred. So making sure you say all these things and make sure you understand that. I learned this from Captain John Miller. And Captain John Miller was in Saving Private Ryan. It's Tom Hanks' character. He's like, gripes go up, never down, always up. You gripe to me, I gripe to my commanding officer. You can't really say things like, I know this sucks, but we're going to handle this. So I think you just say, I see this, we understand this is being addressed. And you be very, 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 very open.
Now, I think what should be done, like, you guys should have had a plan in place for this. I mean, ever since we hired our first employee, the whole plan has been, what happens when this person leaves? What happens when everybody quits? Like, we need to have these plans as part of the structure of the business. And that was part of the reason why I never kept the full caseload. As soon as we'd hire somebody, I'd delegate my caseload out to them, because I always had to be prepared that if somebody left, I could take their full caseload. Like there was always a place for, building redundancy in the system, or else you end up dropping, what used to be a caseload shared among 5 to a caseload shared among 2.
This comes up a lot, Dave. I'll let you jump in, but like, this is where being a physical therapist or any employee and then becoming the manager is not just the most important physical therapist. Management's a different job. So I've seen people in situations where they're like, we're not prepared for this. That's quite literally your job. When 3 people will never call out sick on the same day, yes, you have to prepare for that. That quite literally is your job. And if you're not prepared for that, ask your boss. That's what their job is, to help you prepare. Gripes go up, never down, but information should always be coming down.
And you're right, Jimmy. That's the difference between even management and ownership, right? So like, if this were to happen to me or any of my friends and colleagues that own practices in the Northeast, right? We all have a bench of potential candidates. We all have a bench of resumes, folks that like, they kind of dipped their toe in, they kind of started to interview with us, or they showed some interest, whatever. So if this were to happen at my clinic and I'm the owner, it's like that same day I'm firing out 5 or 10 emails or calls or text messages or whatever. I'm trying to reactivate previous candidates that showed some interest. Maybe they did 1 or 2 parts of the interview process, but they didn't go all the way through. Maybe they went all the way through and we kind of both agreed like, hey, maybe you need to work on A, B, or C in terms of clinical skills or management skills or whatever. And then, let's talk in a year. Like that happens all the time, right? So like this individual who's a facility manager, in my opinion, I'm making an assumption here. They don't have as much skin in the game as an owner, right? So they're not going to say in the message here, if they had skin in the game, they would, if they own 25% of the clinic or whatever, they would have been like, and also I already started messaging and emailing other candidates that in the past year showed interest, and I'm looking to, get them interviewed or re-interviewed and scheduled on the calendar to fill these holes, right? The manager didn't even mention that, which kind of means like there is no bench, there are no potential candidates, or they're going to go up to management and be like, hey, HR, whatever, like, do we have any candidates, any resumes?
Yeah, dude, like this is where I think you treat your business or your clinic, no matter really what it is. We can talk. This is business. We could remove everything about PT from this and still have a valid conversation. You have to act like a Major League Baseball team. You need to act like Moneyball, baby. Like this was in radio. This was beaten in my head. Who is going? You've got a great team. You got a morning guy, a midday girl, an afternoon person. One of them is going to leave in the next 5 years. This is where I go into a little Gary V. Be thrilled that person grew at your clinic to the point when someone else wanted to poach them, or they felt so confident. They said, you know what, I'm going to go somewhere else. Be thrilled at that, but also be prepared for what happens when that person grows up and leaves. This was not personal. Most likely it sounds like none of these were personal, except for that third one. They had to let somebody go as a staff member with a managerial role. Good. Maybe you made a good decision. Definitely. I mean, I'd rather be short staffed than keep someone on who doesn't deserve to be there.
And I would say, to your credit too, everything that this person said, right on point. Like the fact that you were willing to let somebody go, even though 2 other people had just left. Most managers do whatever is easiest for them. They don't care about anything else. So they would have kept that person on, even as dead weight, just because that's another warm body with a license who can bill. Yeah. So to this person's credit, this is something that they're on the right track. They probably already know the right answer. They've thought of all the things that we're saying, but they just put it out there. So we're going to reiterate what they're doing.
And good job being gutsy enough to ask the question to a bunch of numbnuts on the internet. We have a second one that came in as well, because once we got the first Dear Breakfast Club, that's when it happens. The floodgates open. Here's the second one. Is this us? Is this
no? This was a public post. This was not to us, but we're gonna.
That's a good one. Let's talk about it.
This is a public post. Sorry, Dave.
All right. So this was in a Facebook group, a physical therapy Facebook group, Uncaged Clinician, Joseph Klarberg with fourth. What's that?
I said, yeah, I'm in that one too. Go ahead.
Yeah. So with the fourth quarter starting, we're all thinking about the future plans and growth. With the current Medicare proposed cuts for 2025, where do you realistically see the profession in 2, 5, and 10 years? What are you planning to do to combat the potential cuts and remain profitable? Just want to open the discussion to let people brainstorm together and share ideas in public, basically in these Facebook groups.
Right.
Thank you. Now,
they're cool. I like them.
Go ahead,
yeah.
Dave.
So I mean, I don't take Medicare, so I need Tony Maritato to jump in and answer this first, and then I can chime in on my thoughts or our approach.
It's another case where you, the therapist, make the decision. Are you in business to do what you want to do? Or are you in business to serve the consumer, the customer, the client, whatever you want to call them? If I'm here to serve the customer, and I'm going to have two customers, the insurance company and the actual patient who's in my clinic, then if Medicare is going to do something, I'm going to respond, not react, right? There's a difference there. So my response, if Medicare is reducing reimbursement, I'm going to find ways to increase total cart value, quote, revenue. I'm going to add RTM into the system. I'm going to add other cash pay services into the system. I'm going to sell products. I'm going to do more things that my patient wants and is willing to pay out of pocket for. And I'm not solely going to rely on Medicare or any other third-party payer. The other thing is I'm going to optimize the system. I'm going to grease the wheels as long as it works to my patient's benefit. And I am still an advocate and a believer that once you get past that first 10, 15 minutes of time, everything else is just, it's water. What is it, off a duck's back? Like, patients do not remember 60 minutes of education. Patients do not remember all of this clinical stuff that we're trying to drive home and trying to impress them and trying to do all these things. Patients want to feel good. They want to be happy. They want to leave feeling better than they came in. That's it. And I can deliver that in 10 minutes. I can still offer a 20, 30, 40-minute experience. It's just like going to a restaurant. There are times that you want to be there longer, and there are times you want to eat and get out. If I eliminate 4-unit visits from Medicare and I just do single unit visits 5 days a week, I save Medicare money. I make more money. I showed the numbers on a post recently. I think it was a triple the profit for single unit visits with zero extra work, because you're still billing for time. 60 minutes is 60 minutes spread across 4 patients or 1 patient or 6 patients. That's what I would do.
Hold on. You said no extra work. You do need extra marketing work on the front end to get 3 Medicare patients to come in that same hour compared to the 1 Medicare patient at 9 a.m. You need 3 Medicare patients to come in at 9, 9:15, 9:35.
Maybe,
right?
Maybe. A lot of the people we're talking to have wait lists. Why don't we get rid of the wait list? Let those people come in. They've already spent the money. They already did the marketing. Those people are ready to come in. So some people might have to increase their marketing efforts. Some people might have to increase their, new patient admissions, right? So if I have to admit 4 new patients instead of 1, but those are logistical issues that could be solved with better systems. I still would say they're relative to tripling your profit, a little bit of extra admin work, probably worth it.
Yeah.
And that's where I always fall back on.
Yeah. I default.
Go ahead.
I default to this, right? Like, so this is the seesaw I talk about all the time, this visual. So if someone's going to be holding down that price, if you honestly have no control over the cost, the price that you can charge someone for something, then the only thing you can you can bitch about it on the internet. That is always effective. It just doesn't do anything. Or you can work on the value, or you can work on how many different, Tony's changing the game there with saying, well, if I can get more people in and with single unit visits, what am I providing while they're there? Right. This goes back to the very, very simple question of, what business are you in? What product or service do you actually provide? And if you provide physical therapy, using air quotes on a podcast here, you will be beholden to the right side of that seesaw. You're going to be stuck. Someone else is determining the maximum you can charge for your time in that situation. And that is a sucky place to be in. That's why you see a lot of naysayers online saying this is the worst time to ever be a PT. But if you're only focused on the right side, you're in trouble.
Today's point, because you're right. Like, there are therapists in, a development of their business where they don't have enough patients, and it will cost those therapists more. Yes. But there are also a lot of therapists like me. Like, there's never a time where we don't have extra people in the clinic. I have my non-covered maintenance program. You can call it a wellness program. Those patients are floating around. They always have orthopedic issues. There isn't a day out of the week that I couldn't turn them into a legitimate physical therapy patient if I wanted. But I also recognize the value and the benefit to them of just coming in and working out, coming in and moving a little bit.
But you decided there what value you provided, and there wasn't just you're not a train station. There's not one track to go through Tony's clinic. There might be a track or lots of tracks that lead to the door, but once you're there, you say, well, what do you actually need? And then Tony was smart enough to know, well, can I build a track for that? Can I provide that? Like, this person needs, and I'm using air quotes again, they're handheld. This person needs an appointment to stare somebody who has the personality that matches with them every time. The way to do that is to build them for that. But when their benefits are up and you say, do you like this? Is this of benefit to you? Yes. Then this is how you pay for that. I feel like that's where a lot of therapists with the Peace Corps gene deep in their gut fail. It's like, well, they're done. Let me just give it pro bono, which again, I'm for if you can afford that or that's a route. But someone paying for something they find value in is called capitalism.
So where do you go with it, Dave?
So I do want to come back and ask Tony again, where do you see the profession in 2 years, 5 years, especially in 10 years? I want to come back to that. But what you're proposing, Tony, I think would only work maybe in your style of practice, your kind of like approach. But again, I just want to double click on this. If you have 3 or 4 1-unit visit Medicare patients per hour, that takes more admin in terms of like either calling, confirming visits. 10 or 15% of those folks for outpatient are going to no-show or cancel anyway, right? Compared to like the one patient that comes up for 9 a.m. You're going to have cancels there. Therapy. Here's another thing that Tony never addresses. Tony, the therapists are now writing more notes per day because they have to write 3 or 4 notes per hour. Or they use HippoScribe or whatever, but there's still extra work to make sure that it gets in. No. How am I wrong?
Can I answer for Tony?
Yeah.
Can I answer for Tony? Now, I might not get the perfect thing, but this is what you get when you listen to Tony enough. If you focus on the process and make the processes easier, those things aren't as much of a speed bump. Is that something you like, making sure you understand that if you build the process, so if you spend the time and the effort building the process in the front end, the effort goes down and you're not going to earn anything in the beginning when you're building, but you're going to earn a lot more when you go later.
Yeah. That's a huge part of it for sure. So writing more notes, that's what everybody says. It's like, I have great friends and they're like, hey, what are you doing today? I'm like, I'm going to do some errands. What are you doing? Well, I need to do laundry and I need to collect all the clothes and I need to sort them into whites and darks and I need to do this. I need to get the syrup and I need to put them in and I need to switch it. You can break a job into 50 million pieces. The bottom line is, if we're going to talk documentation, we are documenting for time. We are documenting for minutes. So yes, 4 patients, but I'm documenting for 60 minutes of delivery of service. I would argue documenting for a 15-minute unit is by far easier than documenting for 60 minutes. I think there's a lower liability there because I'm utilizing less services. And when you look at how Medicare puts you on the radar, it's generally based on utilization as a component. So a therapist who's utilizing more units per visit, more units per week, more units per episode is always going to have a bigger target on their back. But bottom line, if I'm going 4 patients in 1 hour, 1 unit visit, I am documenting 4 units of care. I don't care if it's 1 patient or 4 patients. Yes, I'm putting it into different accounts, but it's still the same documentation burden.
More clicks, more pages on your EMR. Go ahead.
We're talking 1 extra click. I'm clicking on John instead of clicking on Larry. That's it. It's 1 click. But okay, you're right. And I would say you're right in the sense that, yes, this works in my practice. This works with my personality. This works with my team. It's not going to work for you. But the point in this is, if I can build something that works within my culture, you can build something that works within your culture. And you did. Like you said, I can't do that. I don't want to do that. That's not what I'm great at. So I'm going to go self-pay. I'm going to go out of network. I'm going to stick to where I can deliver the greatest value. I can deliver the greatest value at this end of the bell curve. You're delivering the greatest value at the other end. but don't say that my end can't be done or it can't be, it absolutely can be. And I'm living proof of that. Like I'm here in the clinic today because when we finish talking, I'm going to get out there and I'm going to get my hands dirty.
I do want to show that the feedback loop of actually hosting a live show. The person who wrote in has already texted me and said, "Thank you so much. Jess definitely working on high speed communication. Got news yesterday of a PT starting in a few months. So things are on the up. I like the point of checking in with the current team. I just did that, but before this second PT resignation, always sticky." So the fact that that person's, go ahead.
For that, so that facility manager, first of all, thank you for watching live again. You're incredible. You're awesome. And feedback, we love it. To the facility manager, start texting and emailing that candidate stuff. I don't know. Maybe Tony or Jimmy can give you some ideas, whether it's, events happening in the community, pumpkin patch, pumpkin picking, apple pick, whatever. Like start sending them stuff to build rapport, build relationships, and make the commitment, because they're starting in a couple months. Life happens in a couple months. You have no idea what can happen between now and then.
That's it. Why? Because yes, on October 1st, life happens between October 1st and November 1st. And if you're holding your breath on that one, again, going back to my days in radio, which is where like my experience comes from. If that person is there and then they're not, and that was the thing you were pinning all your success on, hope's not a plan, my man. Like, so yes, have a bench, be warming that bench.
Now you could do peer reviewed articles to each other, like a little journal club over email, like literally anything. But go ahead, Tony.
I was just going to say that same principle is why I push so hard to get patients in today. If you call my clinic this morning, you were coming in this afternoon, because anything can happen between today and tomorrow, today and next week. We complain about, to Dave's point, well, I don't have enough patients. Well, how quick are you calling them back? How quick are you getting the evaluation done, building that line of communication?
Dude, I don't know anything about this business model, but I started listening to that Corner Office podcast, and I mentioned it to you guys. And he's just a guy who like analyzes businesses really quickly. And I had to help somebody move really quick. So what did I do? I Googled moving and in the name of my town, and I got like 4 or 5 different places. And I blew off a couple who just wanted me to call. I wanted to fill something out and like get a quote or get a text or something. So I found 3 of those to their credit. And I got calls or texts within 5 minutes. I mean, these people were aggressive. And then I thought about it. If I was in the moving business and I have a truck and a bunch of dudes outside, I'm not making any money. So that one job deciding yes or no is binary. I think PTs should pay more attention and act like moving companies, which is get them in today. Because if you let them go a day, a week, or a couple of weeks, that person's going to either decide that's not a problem anymore, right? Or go somewhere else to get that solved. So act as if. And I don't know, man. I feel like your job as a manager, that's part of it.
So let's pivot just a little bit, talking about Hinge Health. I had kind of forgotten about that topic, but I will say, preface this, about once every month or two, somebody in the family sends me a screenshot of a flyer or an email or something they received through work saying that they could get free physical therapy, virtual physical therapy, and it kind of brings it back on the radar. So Dave has a great interview with Brian Williams. You guys have amazing conversation, and I was rewatching it again this morning before I came in. But Hinge Health came back on my radar because yesterday I was scrolling through LinkedIn and I saw a therapist post a job opening for Hinge Health. And it said, hey, come work with me at Hinge Health, pelvic floor, women's health. I was like, oh, I wonder what their job, posting looks like. So I go and I take a look, and it's awesome. I mean, I was blown away. I was so impressed by the quality of the job listing, what they were promoting, what they were doing. And I know, I go back to, there was all this controversy about them calling it, was it virtual physical therapy, AI physical therapy? Is there a physical therapist? So, of course, I shared that post. I got another inbound message or two from other therapists who work at Hinge. And I was genuinely impressed. Like, it sounds like they're doing amazing. They're doing a great job. They're moving in the right direction. I don't think we have an accurate depiction, because I think and it's the royal we as therapists in general, think either we're going to lose our job because it's going to be AI physical therapy, and that's not real physical therapy. And if I can't touch people and I can't, connect with people, then it's not effective. But I still stand true to that perspective that there is a huge demographic, that doesn't want to be touched, that doesn't want to bother with a person, that wants a solution, wants an answer, wants to do it themselves. Huge. Or as
I feel like
my
Dave
cousin
disagrees.
Vinny, huge. It's a huge demographic. And we just don't even know, because again, we're not talking to those people, because those people aren't even putting us in their ecosystem. They're not giving us a chance. I think this opens a big door for us.
Dave disagrees. We love when that happens.
You know what I want? I want a virtual roofer to come over, and I want a virtual house painter to come over.
So what's interesting about that, Jimmy just said, I don't want to talk to them on the phone for the moving company. I just want to fill out a form.
Right.
I want them to tell me, I'm putting words in your mouth now, how much it costs, when it can be done, and just get it done. So yeah, you're never going to get a virtual physical therapist unless we get that robot, that $60,000, $80,000 robot that does the massage for us, and we can send it to their house. Not going to happen, but I would use the robot. But that being said, that's not the demographic for this. The demographic for this is the person who's just like, I don't even know what my doctor said. They're giving me this order for exercise, but I'm in too much pain. What? I every single week, I have at least 2 or 3 people who are like, I don't know why I'm here. I've got back pain. I can barely walk. My doctor wants me to exercise. That's crazy. You haven't even gotten an MRI. How can you know what to do for me? That's what the patients tell me every single day. And you put that person behind a screen, now at least they have a little sense of security. They don't trust you. They don't like you. They don't know you. So you give them a little space, and maybe some of them will come so you can rub their back. I don't want to do that, but there are therapists who do. But I think we can have access to just so many more people.
I love the comparison between Jimmy McKay finding a mover, which Brian Williams and I discussed this in the Hinge Health is Dead episode on the Dave Kittle Show. Uber, Lyft, car rides, even moving. Now, moving is a little more emotional with your stuff and all that baggage, pun intended. Like, I get it, but moving someone and their stuff is way more transactional. It's closer to, I want to ride to the airport. I don't care if it's Lyft, Uber, Harbor, car service, whatever. As long as they have a pulse and they kind of drive safely, and I don't even ask if they have a license or if they're insured or whatever. Like no one asked that, right? So there's things nowadays that are more transactional. But someone putting their hands on you, Tony, I agree. Or someone who's a healthcare provider that now they're going to ask you questions that's going to bring up maybe emotional triggers, or it's going to bring up previous injuries or car accidents or other emotions, and you're trying to build a relationship. That is very different. I would say we're closer to, I don't know, like what realtors do and what people do at like Rotary and like the PTA and all that. Like, it takes time. It builds relationships. And Brian Williams and I discussed this. There's a difference between whether it's home therapy or outpatient therapy, way more on the relationship side, and other things that are way more on the transactional side. Yes, Jimmy doesn't care about calling in. He wants speed. He wants to get it going. And he doesn't really care. They're not asking him like, so why are you moving? And tell me how that makes you feel and all that.
Right. Brian Williams graduated Marymount University. Go Saints. So I think it all depends, right? This is like good. Like, I'm positioned in the middle of Tony and Dave on the video. I jotted down some notes. There's Home Depot, there's handymen, and there's contractors. I can do some stuff myself. I don't know a whole lot. When I bought this house, I owned a screwdriver and a drill, right? So I was going to Home Depot for some stuff. Some stuff was out of my league. I went to a neighbor or a handyman, and then sometimes it's like full-on contractor, right? Some moments I want to drive and I want to be in complete control because I want a road trip. I want the experience. And sometimes I just want to ride to the airport. As you mentioned, Dave, how many times have we ever asked if that person even has a license? How many times have you been asked if you have a college degree? My running count, 0 times. But it depends. right? And I know it's cliche in this profession to say like everything depends, but it does. So I think there's a time and there's a place for it. I think like an app like a Hinge Health or virtual care, there's a place for it. I don't think either end is going to go away. I think this virtual thing is just coming on, so we're questioning its viability. But the fact that there are apps like that, because sometimes I just want a little bit of information. Sometimes I just want the information really quickly. I think you can keep overhead low and you can reach so many people that you would only need to charge this much. Or what Hinge Health is doing too, you go onto Hinge Health's app and you type in your employer and it figures it out for you, right? Because there's that big stumbling block. I don't need to like figure out my insurance before I get an Uber. I just go onto Hinge and I'm like, I don't know, what's our insurance again? And I type it in, we got it. Same as Warby Parker. It's like, just take a picture of your prescription from your eye doctor. We got it. Like they understand the biggest initial pain point to getting that person to begin the process. You remove that barrier. I just wanted a quote. Is moving $1,000 or is it $10,000? If it's $10,000, I'm going to go pay my friends and rent a truck. If it's $1,000, take my money.
Yeah, I totally agree. I love it. You're right. There's people who want transaction. There's people who want relationship. But I think that we miss the people who initially want transactional because they don't know what it's like. They have no idea. They come in here and they have no idea what to expect. And so you can imagine, like, I always say this about massage therapy. I'm like, wait, you want me to go into a room, take off my clothes and lay on a table with somebody I've never met, who I have no idea who they are, like it's the most bizarre thing to most of my geriatric patients. Obviously we have cultural sensitivities and all this other stuff. In physical therapy, I mean, there's plenty of physical therapists that expect patients to take off their shirt the first day they meet them. Like there's therapists who think I'm going to touch you the first day I meet you. It completely skips so many steps in the process of building trust and building a relationship. Go ahead, Jimmy.
I was gonna say, you had just commented on a comment from, or a quote from Mark Cardula, which is the great question to ask at the end of a session, which is, have I met your expectations? It'd be also great to ask before. What are your expectations of today?
I ask every single one of my patients, I'm like, so what are you expecting us to do today? What do you think we're going to, achieve? What are you hoping to see? And every time it's, I have no idea. I have no idea what to expect. My doctor just told me to come here. I'm amazed anybody ever goes to physical therapy when their doctor tells them to go to physical therapy. So that's the population that I think we need a low barrier entry. We need less friction. To Jimmy's point, it's free, it's easy. Let's give this a try. And then a small portion of them might go to the next phase, might build a relationship. But when we talk about that number 7% or whatever of people with low back pain actually go to therapy, I'm amazed it's that high. And interestingly enough, we don't even have enough therapists to serve that population.
Right.
So we need to offload this huge demand. And this is just one tool that can do it. What's he saying?
I love this comment from Will. And it's not about physical therapy. It's about business, right? Will says what he loves about these competing or complementary ideas is that we can leverage tools for mass marketing to see what lands with more prospects and see what gets them to take action. This is why I was in radio. There were 3 reasons people got into radio. You wanted to be famous, you loved music, or the science experiment, the social, live, real-time science experiment. I liked music. I didn't mind being in front of people, but this is what it was. I want therapists or everybody listening to understand you're in this business. You have to be in this business, which is sort of changing what you do and then using these tools, right? Hormozy said it the other day. I listen to it a lot. Whenever I get frustrated with anything I'm doing, there's 3 ways to reach people. You run ads to get in front of them, you create content to get in front of them, or you meet them one-on-one. Tony and I, just to throw in a plug, we're going to be meeting people one-on-one at APTA's PPS, Private Practice Section Conference, in a couple of weeks. While we're there, we're going to be recording content with them. So we're doing 2 birds in 1 stone. But I know you are altruistic. I know you want to help people. I don't even care what business you're in. I want you to understand what Will just said. You can have these ideas. This is why I think this is what attracted me to Tony at first online, which was you were just doing stuff and you were like, hey, here's how it's going. It sucks. And I was like, look at somebody else like showing that they took a leap and it didn't work. I just learned a lot from that. Hey, guess what? I'm not going to step in that pothole. But what did he learn from it? Hey, well, 90% of it was a fail, but here was a happy accident. I want people to understand that as a therapist, you're in this business of trying stuff. If you don't, when Medicare cuts things, you will cease to exist. All those clinics that are going out of business are not adaptable.
So 2 things that came out of Dave's interview with Brian Williams. If you haven't watched it, go to the Dave Kittle show.
It's a good one.
Look for Hinge is Dead. It's an awesome interview. But 2 things that came up. I was shocked when Brian Williams said that if you just want exercise, go see a personal trainer. That blew my mind, because the ultimate irony, and I guess this is what keeps the dynamic going. To me, the easiest thing in the world I can do is rub someone's back and make them feel better. The hardest thing I can do is use exercise to make them stronger and healthier and more resilient. And I feel like, the difference between us and a personal trainer is that we absolutely have the depth of knowledge and understanding of physiology and psychology and emotions and endocrine system and all that stuff to use exercise as an effective tool. I was just blown away. What was your thought on that? Because I couldn't tell if you were like, yeah, personal trainers are better or whatever. What do you think?
I agree with you, Tony. I would say, like, especially our older geriatric population clientele, like, they need mobility, they need movement. Some of our clientele, like, they're scheduling us, whatever times a week. And like, that might be like one of the only big times that day that they're actually moving, other than to use the restroom in their apartment. So I agree with you, Tony. And I don't completely agree with Brian on that about movement, exercise. And if they just want that, personal trainers, I agree with you, Tony, that is a big challenge or hurdle for any physical therapist for some clientele, to be able to educate them and have them do it. And you're right, it is easier to just kind of rub their back and have them do something passive. So I do agree with that.
Yeah. Decide if that's a patient population you want to work with. I don't think I understood how little some older adults move until some people close to me got a little older. I was like, wait a minute, like, that's all, not that I always had a soft spot in my heart for physical therapists who work in geriatrics. I think my soft spot has only grown, and my understanding of their importance has only gone way, 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 way up, which is but it's hard to communicate that when you're sitting in class in PT school, right? Especially when you're 25 and you're about to go bang out a CrossFit workout. And you're like, yeah, old people. But understanding what that value is and how much either that person would pay for it, or I don't want to say pay for it, but pay for it in their time and their investment, or how much that person's family would be like, yes, get them moving, please, please, please. I'm seeing everything decline physically, mentally, emotionally. These other 2 decline as that person stops moving. It's not good.
The other part of your interview that I thought was so interesting was you guys looked at the move that Hinge was making from all digital, all online to in person basically as, oh, they're failing. This is proof, the model doesn't work. But yep. I didn't see it that way. From my perspective, if I was starting a company today, I'm like, especially at a venture-backed size, and now that I understand that world a little bit better, I'm like, I can't grow $1 billion company on the back of a human therapist. It's never going to happen. It's not scalable enough. So what I need to do is I would start digital, grow as much as I could digital, and then I could start to roll in the human aspect to it, because people understand humans, people understand services, people understand that a little bit easier. But I think the reason why they brought the human side to it is because, they want to improve kind of their background. They want to improve their image. People just understand, therapy has always been delivered by a human. But I think it's more to support the digital side than it is because the digital side wasn't profitable enough or wasn't successful enough. I just think you can't scale human services to a multiple billion-dollar valuation.
So you're saying, hold on a second. So let me see if I understand. So you're saying that this might have been in the plan all along, but you knew that the way to do it to scale is digital first and then the other way? Because I did look at it like, hey, they tried something and now they're pivoting.
Yeah, I think it's like Elon Musk and Tesla. They went super high end, really expensive, and then they started to bring the price down. I think these guys probably knew we can't grow to that size. We can't access enough capacity in human therapists. So how can we grow to $1 billion fast? Just do it all digital. Do it with an app.
And then work backwards, and then come
Yeah.
backwards to the model that you know already works, instead of competing with everybody else in a crowded market. Dave, you're going to injure your neck. You're shaking your head so much.
Yes. So, I mean, I'm against Hinge Health. Fine with mentioning it again. Okay. So real quick, if people don't know, Hinge Health, they sell this benefit, this employee benefit to employers. So Tony talks about it all the time, like, who's your customer? So for Hinge Health, their customer is either an insurance plan or it's a direct to employer plan. So they might have insurance companies that are the customer. They also definitely have the employer funded plans, and they're talking right to the employer, right? So then the actual employee, the actual quote unquote patient or client, is then not really the customer. But anyway, the employees get this for free. Guys, we've talked about it numerous times on the show. When something is typically for free, it's not really taken all that seriously. It doesn't appear valuable. It doesn't appear like something is all that meaningful. So yes, they are VC backed. They're a tech company also, by the way. So Hinge Health is a tech company. Them pivoting into in-home physical therapy visits is absolutely a pivot, and more so probably some grasp at some cash and profits, because I believe their core technology does not really work. And what I mean by that is, if these patients or clients were no longer employees of the Walmarts, the Cargill, the Facebook, whatever the big companies are where they get this for free, if that employee leaves that company, now they no longer get Hinge Health for free. And Hinge Health emails them and says, hey, this is $10 a month. This is $20 a month. This is $100 a month, whatever, for virtual, whatever. A significantly small percentage of people are going to pay out of pocket for Hinge Health, the consumer, the actual consumer that is paying their own hard-earned dollars. That is why they pivoted to in-person visits, in-person physical therapy, house calls, because the core technology does not really work. The end consumer doesn't find value in it. That's why.
Jimmy, you got any thoughts?
Yeah, I mean, I would be nervous about that. It's hard. I see why they went the route they did, because it's easier to get 1,500 companies to say yes to something than it is to get 15 million or even 15,000 individuals to pay $10 a month. So I see where, so it's B2B versus B2C. B2B is like, hey, here's a way to save 20% on your self insured, right, or here's a way to do this, and it's a delivery method. And hey, we're going to do the messy work for you. If they use it, great, and if they don't, also great. So I see why that's a value. I do think it goes back to Will Boyd's point, which is like, test it and see what it works. I feel like everybody in our profession should be paying attention to these models and seeing like, hey, are we as valuable as we think we are? Or sorry, is the perceived value of what we do in this method as valuable as we think it is? I mean, there are practitioners who are completely telehealth right now, right? But they're able to understand like what the process is. They're in a marketing department.
How many can you name that are 100% telehealth, that are a physical therapist? How many can you name?
Oh, I don't know. 5
that are making a full-time living on it.
I don't know,
because there's not that many in my opinion.
Yeah,
there's not that many. And now we're out of COVID. I have some quotes. Can I give you guys a quote from a colleague that has a couple clinics, brick and mortar?
Yeah.
All right. So Ben Boggy, I asked his approval. He said yes. I could quote him. So Ben Boggy, cash practice. He's got a practice in San Diego, Des Moines, Iowa, and Oakland. So 2 different states. This is the same thing with Ron Miller, by the way, in Orlando, Florida. But Ben Boggy, I asked him last night because we were going to tee this up. So I asked him about telehealth, virtual visits, video visits, all that. And he says that they still offer it, but it's only a handful of visits each month. And it's usually when one of their patients or clients is traveling. Ben said that they don't advertise it. They don't promote it because his PTs don't enjoy it. They don't enjoy the telehealth video visits to deliver them That's what he said. And then also it seems to be quite a bit of friction from patients anyways. So, and then Ron Miller in my practice, cash practices, no one is calling in asking for video visits anymore. No one's, at least us. Now, I'm trying to just give some anecdotal, points of view. But, and again, I know my only caveat is sometimes I'm like, is Tony right? Is there a critical mass of people that don't want manual therapy, that don't want to have in-person anything? I think Tony is overestimating that population of people. I think it's lower. Maybe it's somewhere in between. But in general, there's not many physical therapists making 80, 90, 100K a year doing all 100% video visits.
But let me pair these two things together. Where do you think this will be 2, 5, and 10 years from now?
Because it will not change. It will not change.
You don't think that generations and what people value changes over time? 5 years is a long time, right? Like different generation moves into the middle of that bell curve over time.
Yeah.
I don't.
I think it'll change. I think you're asking a fish how the air smells. You cannot take a therapist who has been raised in a culture of being in person and try to throw them online. Like we have to look outside the profession. We have to look at examples that exist in other industries, other things. Absolutely. I think there is going to be a major shift toward,
right.
Accessing this capacity of people who do not want to go to a therapy clinic, don't want to be in person. I'm shocked at the people in my clinic that are doing telehealth visits with physician specialists every single day. People I would never imagine would be comfortable getting on a FaceTime or a Zoom or whatever the doctor is doing with them. It's blowing my mind, and it's making me rethink my own biases.
Yeah.
But I think that it needs to start from the ground up. I think it needs to, be something that in the school systems, the schools are teaching young people who have never known what physical therapy is, that this is one way to deliver these outcomes and these experiences.
The customer and the healthcare provider, right? I mean, Google Glasses and the new Apple goggles, there's a phrase for that. The phrase is ahead of its time.
Yeah.
It's not a bad idea. It's ahead of its time. It's like, hey, listen, we're throwing this out there knowing this thing is not going to take off, but we're going to this is market research for us in real time across a real audience. Goes back to what Will Boyd was saying. It's like, you're in it for figuring out what parts about it did you think people would like, and what parts about them do they actually like, or do they actually gravitate to? You can't get to that by guessing and thinking. I think it will change. I think it'll be a while.
And if you go back again, who 50 years ago would think you would just rent a random stranger a room in your house, or rent your whole house, or would go, and pick somebody up from the bars on Friday night who you've never met when you're not a taxi cab driver with a medallion? Like, technology is going to change. Experiences are going to change. People's expectations are going to change.
Yeah.
I think we're going to see it.
I don't think it's all or nothing, though. I don't think it's people will never, right, Dave?
I mean, it's not all or nothing. Yes, it might shift over time, but here, the example. Now, one thing, again, Tony always provides great rebuttals. So the fact that we didn't have DPT students learn this, it wasn't a track in school, it wasn't a class or a course in school. That is a great point. Like, if you install that, like, then in 5, 6, 7, 10 years, whatever, those physical therapists, you're right, maybe they will be better equipped than we are right now to deliver a video visit. Let's put that aside for a second. The example of Dr. Ben Boggy, so ProKinetics PT, they have 3 locations. All their marketing, their website, their communication, their ideal clientele, active clientele, active patients, active adults, and CrossFitters. They run ads. They say, hey, if you're an active adult and CrossFitter, and even he just said and I got his approval for that for that statement. Even him, where they're active adults and CrossFitters, and he said a small percentage, a few visits per month are virtual. Now, again, to Tony's point, were all his DPTs trained in telehealth visits and how to do that during clinical rotations? No. Was it in the coursework of the DPT program? No. Great point. I agree with you, Tony. But currently, right now, he's their active population clientele And even that clientele of patients, there's minimal demand. No one's coming and saying, do you have this? Do you offer this? Maybe you put on the website, maybe a few more people ask about it, whatever. I just don't think we're there right now. You're right. 5-10 years down the road, a lot of things could change. I don't think it's going to change. I think physical therapy is always going to have some physical in-person component. But here we go. Jeremy Sutton down in Louisiana. Hashtag Team Dave. Here we go, baby.
Real quick, just going back to a point that you made that I also agree with. I agree that if you take something like Hinge out of the employer funded, benefit package and you just offer it for sale direct to the consumer, I don't know how many of those people that were getting it for free would all of a sudden say, yeah, I would pay $10 a month for that. I don't think it would happen. But to your point, what is the problem that they're solving? And I think we get a little too short-sighted. I hear therapists all the time. They're like, yeah, but we save money. And if they go to therapy, they avoid surgery. And I always ask the question, I'm like, for how long? How long do they avoid surgery? Because I get to see a lot of people who come to therapy. They have back pain. They come to therapy. We make them feel better for a while. They get discharged. We think we're the heroes. We think we're amazing. And then 5 years later, this person comes back and they had 2 surgeries between the time that we discharged them and I'm seeing them today. And I'm like, what happened? And they were like, oh, it got, I felt better. And then I got worse. And then I had surgery. So from a payer's perspective, a third-party payer, an insurance company, the therapist is short-sighted and saying, yeah, but we help them avoid a $50,000 surgery for a little bit, but not over the lifetime of that beneficiary for the insurance company. We have no idea what happens after we discharge them from our therapy services. And so I think with the employer, like, why do insurance companies now require patients to go to therapy for 6 weeks before getting an MRI? Because they know that most things are going to resolve in 6 weeks. And then if they don't, okay, we'll do the MRI. It's not because therapy is necessarily helping, quote, solve the problem. We're giving them peace of mind. We're building confidence. We're making them a little healthier. I think the employer, it's the same thing. The employer, it's, okay, I'm going to bring Hinge in because it's going to be a distraction. It's going to buy me time. It's a less expensive, more affordable option to lower my overall cost. Might not be perfect for one individual person, but for a community of 10,000 employees, I'm probably going to save more money with Hinge.
The question you also asked too is, when I see people marketing, we help you avoid surgery, knee surgery, and knee surgery costs $50,000. Doesn't cost me $50,000.
Yeah.
You're highlighting what it saves my insurance company. No offense. I want them to spend $50,000. You know what? Ring them up, baby, because I feel like every time I look at my paycheck every month, there's money taken out. What you've just highlighted is it doesn't cost you anything, cost your insurance company something. So talking to people about what they actually value, this is hard. There was a comment you made the other day, which is the limitations of language of what we actually provide is difficult to convey, right? That's what makes, this is why we have so many conversations about why maybe different products or services or professions do better. And I'm using air quotes, but it's difficult to actually communicate the full width and breadth because our profession is so wide and deep.
Yeah. Are we getting ready for parting shots?
Yeah, let's do parting shots after we got Will. Will saying he feels like if a small private practice tried to sell the commodity of PT versus selling the experience and status, it's going to be a race to the bottom. If you sell yourself as a commodity, Amen. You will lose. You're not going to lose tomorrow. You're not going to lose next week. But over time, when things shrink, you will. But if you build relations, stories, and magic, I think that's what Seth Godin said, right? People don't buy products or services. They buy relations, stories, and magic. People will want to buy that. All right, parting shots. What do you got?
I wish we could just be 100% virtual. It would be a lot easier on myself and my therapist. No one is going to pay $200, $300, $400, $500 a visit for a virtual visit. Now, of course, they might pay once. But we have some clients paying $2,000 a week. Show me a virtual therapist that's making $2,000 a week doing from one client. It's not happening. I wish it was like talk therapy where we could just do this virtually. I mean, yeah, and get the same outcomes. It would be great if we could. It's not the way I understand consumers right now. It is what it is, and that's our current business model. And yes, there's always room for us to listen to folks like Tony Maritato, see what they're posting, see some of their insights, incorporate some of these insights, and maybe add some of this on the front end for, consult or eval, or when they're traveling like Ben Boggy's doing, or somewhere in the continuum. In 5-10 years from now, virtual physical therapy will still be a very, very small percentage of overall visits or encounters between patient and provider.
The internet never forgets. Go to the Dave Kittle show. Go watch the video. Brian Williams, Dave Kittle. We'll come back 5 years from now and we'll see what it says.
That's your parting shot?
That's it. That's it.
That's the longest. Yeah. I think it's a yes and. People want hands-on and hands-off at different parts. It's probably not going to be all like, I understood that hiring a moving company, I'm going to have to talk to some movers at some point and let them in. I just didn't want it at the beginning. Like, I wanted 3 quotes and I wanted it in 15 minutes. So if you give me that, but later on, maybe I wanted to know where my stuff was in transit. Do I have to call someone and explain what my number, or can I just click a link? So I think the answer is, what problem are you actually solving? And then how are you solving it? That's later, right? What problem? Why did I pick you over someone else? Not why you do it. That's important to you and your mission statement. But what problem are you actually solving? And then can you build different ways to solve it? If the answer is no, I'm going to pick someone else. We're back on Thursday. We'll start to talk about, I want to know who else is coming to PPS. I want to know who else is going to the actual conference. It's not a cheap conference. They raise their prices. People keep coming. So why are you doing that? Are you going to PPS? We'll see you on Thursday. The show today brought to you by the Academy of Orthopedic Physical Therapy, the leaders in orthopedic physical therapy. Find them online at orthopt.org. Now, with their current concepts of physical therapy in their 5th edition, it can help you prepare for that OCS examination. Find them online at orthopt.org. The Brooks Institute of Higher Learning gives you advanced post-professional education with 7 on-site PT residencies, including orthopedics, women's health, pediatrics, sports, and neurology, as well as an OMPT fellowship, all focused on experiential learning. Find out more at brooksihl.org.
The PT Pinecast is a product of PT Pinecast LLC. It is hosted and produced by PT Pinecast CEO Jim McKay and CBO Sky Donovan from Marymount University. We talk PT, drink beer, and record it. This has been another pour from the PT Pinecast. The PT Pinecast is intended for educational purposes only. No clinical decision-making should be based solely on one source. While care is taken to ensure accuracy, factual errors can be present. More on the show at ptpinecast.com.